If you've ever wondered what mental health therapy is like, you're in the right place. This is my second video. My name is Michelle Adler. I'm a mental health therapist and a licensed professional counselor. I'm hoping to decrease the stigma of mental health, and I think we can do that by keep talking about it. So please like, subscribe, share. Even if it's sharing to your social media, I appreciate getting that out there. So I'm in my office today and I'm going to show you what it looks like. So let me move the camera around here. I'm in the corner, so I have to go this way. And as you can see, kind of looks like a living room or a sitting area. Oh, let's get the side view. And most therapist offices kind of look the same. We try to have like a comfortable, cozy area for you to sit and hopefully feel comfortable. Oh, we got a little movement there. Because, you know, you're meeting a perfect stranger and talking to them about the most intimate details of your life. Hopefully you have a good rapport with your therapist. I think that's always important. We all are different in the way we approach things. We all have different personalities. So it's very important to find a person and a personality that matches you, so you feel comfortable and you can do some of this work. The other thing that I think is important with therapy is confidentiality, and I talked about that in the last video, and we're going to talk about the exceptions here in a second. But confidentiality means that we can't talk to anybody about your business without your permission. Now, all of us have different training, we have different schooling, we have different specialties. My specialties are in trauma, in anxiety, ADHD, divorced parents and their children. I think I got that out. Couples, and I do work with kids on just about anything. I really like working with kids. It's kind of fun. There are some things that are unique to therapy, and I think part of that is we have to figure out what you need and then how to deliver that to you. And I conceptualize it like gears. So the one gear that I think about is your personality and how you think about things and how you learn. And the second gear is like what you need to learn. And those have to fit together. And like gears, they're all unique with different notches and so forth that have to fit together. That's just my thought about it. I'm sure another therapist could give you another description, but I'm hoping to help visualize that picture for you. We have to be very careful in therapy. We want to kind of stick to therapy, which can be hard because the longer you're with a therapist, the more you get to know them. And so we want to make sure that we're on your goal path, like what you want to work on. And everybody changes in their own space and time. So what your goals may be are not going to be like somebody else's. And maybe when you're ready to go to therapy isn't the time somebody else will be. We all have things going on in our life. We all have circumstances that we can't control, and we're all dealing with different things. So no judgment. The other thing that is tough in therapy is politics. You can all imagine why, especially the climate of how awesome it is. I think the last presidential election was miserable for every therapist in the country. I think I could speak for that. And I don't feel like this one's going to be any better. So we're not here to talk about our political views. Certainly I don't mind if people talk about their political views. My concern is how are your views and how are politics affecting you? Are you having anxiety about this? Are you having fear about this? Are you having issues with your relationships with others? So we're trying to make sure that we're focusing on therapy all the time, doing things that help you to be better. And you get to choose that. So make sure that you are choosing that and that it's right for you, because you can choose another therapist. Like I said, there's tons of therapists out there and we all do different things, different personalities. So you have your pick. Also want to make sure that your therapy is in line with your spiritual beliefs, your religious beliefs, ethics, culture, all of those things. We all have different, I guess, specificities in that, if I can say that, or different boundaries. So it's up to you to tell the therapist if they're in the right area. And if they're not, then they need to know. I always tell people to advocate for yourself. These are your services. We're here providing the service for you, so make sure you're getting what you need and you're getting a good service. So what is therapy not? This can be a tougher subject. Therapy is just not talking. It certainly can be a lot of talking, right? Because we have to communicate that way. But therapy is about a therapist interacting with you, seeing what you need, trying to figure out how to deliver that to you, and problem solving a lot creatively. So even though we're taught a lot of theories and skills and techniques, it's up to us to kind of tailor that to you and keep it creative. Otherwise, we could just hand out pamphlets to people and go home, right? Because you just could read it and figure it out. You wouldn't need any tailoring or creative changing. So we can do that. Therapy also isn't something that's isolated to talking. Sometimes it's play therapy, and we do that a lot with kids. And I have had people say when I did mobile therapy, can you believe that she gets paid to do play with these kids? I certainly do, but it's intentional play. Kids learn through play. And so if you remember when you were younger, I'm hoping that you played games, because games show you how to take turns. They teach you how to lose, how to win. They teach you how to follow the rules. All those things are important throughout our life, and especially when you're an adult and you don't have people monitoring that. I mean, you have the law, but not every day, like in your face, like a parent would. So games are very important, and I like to play those for those reasons. Also, they're a good distraction for kids, because when you come to a therapist's office, it's nerve-wracking. I get it. I would feel the same way. So we're trying to maybe distract them a little bit, so they're not focused on that this is therapy and this is a weird person that's trying to talk to you about things. And sometimes they don't even have the language or are able to describe what's going on. Our brains don't stop growing into our late 20s. So you can imagine at 5 or even 12 or 14, we sometimes not sure what to say or to make of things. So kids can show you through therapy too, which I think is super cool. People often tell me, or often ask me, how do you know if somebody's lying in therapy? Well, the answer is, to be honest with you, I can't tell for 100% certainty. And to some degree, I don't care. What usually happens is if people are lying, the consistency changes, or we find out that something's not meshing right. Most of us have really good instincts. I know I do. Mine are like super sharp. And I'm not a human lie detector. I can't always tell when people are lying either. But what I do know is the same issues that we have in the real world usually manifest themselves in therapy when you're here long enough. So the truth isn't always important. I guess it's more important of what's going on, how a relationship's going, and how you're dealing with that. The other thing that is tough in therapy, and I mentioned a little bit earlier, is about confidentiality, because there are some exceptions, and sometimes we don't realize that. So the exceptions, and this could change state to state. So everything I'm talking about is in Pennsylvania state, because that's where I'm at. In Pennsylvania state, for confidentiality, we can't release your information to anyone else except you without your permission, except if you're trying to hurt yourself or others, if you're hurting children, if you're hurting people with disabilities, if you're hurting elderly people, because we're mandated reporters. So we have to report those to people to keep them safe and to keep you safe. Now, that doesn't mean that we can call your brother, sister, mother, and whoever and tell them whatever. We can only break confidentiality to maintain safety. The other exceptions are if there is a court order. We can go to jail if we don't adhere to a court order, just like anybody else. So they can subpoena our notes, and our notes can be read in court. Or sometimes the insurance company will ask us for a chart to review to kind of check and see that we're doing what we need to do, because there's certain things we need to do to be able to get reimbursed for payment. And so they're not looking at the details of what's going on, they're more focused on what we're doing. But those are some exceptions I thought are probably worth talking about. Now with kids, it's a little bit different, because in Pennsylvania, and again, I don't know if this can change state to state, but I know in Pennsylvania, when a kid is 14, they can refuse services or they can ask for services. That also means that they have the right to keep their files private, which is interesting because I'm a parent too, and I understand how difficult that can be, not knowing what's going on with your child. So I always kind of explain that in the beginning when I have younger people coming in, and I talk to the child and the parent and talk about how you want to deal with this. Sometimes parents are okay, sometimes parents aren't. And it's the law, so I don't have any argument either way. I just have to follow it. But what happens is we can have the kid sign a release, and they can say, yes, you can be privy to all my records, or you can only know what I go over with a therapist and I think is okay, or you can only talk to them about appointments. So we can do all different kinds of things, but they're in charge of what gets told to their parents and what doesn't. And I told you about the exception. So if there is a safety concern, we do have to report that to keep people safe. I think that's important to remember. Now, the other fun things that deal with kids are custody agreements, because we have a lot of folks that are divorced, separated, and all kinds of different custody agreements. It's not always one parent that has the primary care or the ability to say what kind of services their kids receive. So sometimes therapists will ask you for a custody agreement if the parents don't live together. And that's really to keep the fighting down, and to also if there's any legal issues. Because if both parents have primary custody or say over how the children's medical and mental health things go, if one person disagrees that the kid shouldn't go to therapy, then they cannot go, which makes it difficult, because we're asking two people who obviously don't live together for reasons that they couldn't get along. We're asking them to get along about therapy and potentially the therapist that they choose. So that's a good time, but we work through it, and those are some of the ways we do that. I think it's also important to let you know a little bit about therapists, because this has come up a couple of times lately even. Therapists can only practice therapy in the states that they are licensed. So I'm licensed in Pennsylvania, and I can only see people in Pennsylvania. Even now that we have more telemental health, I can't see people online in different states. It is illegal, and I can get charged. I do remember another therapist talking about how in New York it is a felony charge to practice therapy without a license. So if I'm doing telemental health therapy from Pennsylvania to somebody in New York State, in their home in New York, I could get charged with a felony. So if there are people doing that, which is what I'm being told, that's their license, that's their issue. But I'm keeping my license, and I don't want to do anything wrong. So I'm just letting you know. Also, we can transfer our license from state to state, but some states don't work with others very well. I remember a lady trying to transfer her state. She was living in Florida, and she was moving to Pennsylvania. Well, Florida and Pennsylvania don't transfer well, so she had to actually transfer her license from Florida to New York to Pennsylvania, just to show you how different the states are. And I think now that telemental health is so big, they've been looking at that and trying to figure out how we can work with that. So we might see some changes coming up, which is super cool. Another thing about therapists is that we should be seeking supervision about our patients, because we need to maintain boundaries, and we need to always be checking for transference and countertransference. So we need to make sure that we're healthy, right? We need to make sure, sometimes we miss things. And when we're in practice by ourselves, we don't have a lot of people around to talk to, right? Because I'm here by myself. So it's good for therapists to check supervision with other therapists. And what we do is we talk vaguely about a case, so we don't give any details that would reveal who that person is. So if they knew them in the community, they wouldn't know who you're talking about. We're just talking about the case in general. And really that helps, because we're not the end all be all. Sometimes we miss things. Also, therapists should be maybe even getting their own therapy, checking their own mental health. I think therapists have a duty to do no harm, right? I have my own therapist. I think she's wonderful. I appreciate it. Keeps me healthy. And I certainly don't want to hurt anybody else. Because we're trained to be therapists, but we're also people. And that can be very tough. Now, I mentioned boundaries a little bit. And what that means is that we cannot treat our friends or our, family or anybody else we know. And the idea is because we're emotionally involved with them, and we need to be objective. So as a therapist, we need to maintain our objective. When we go out in public, and this pertains to confidentiality as well, I usually don't say hi to people unless they say hi to me, because it's their confidentiality to break, not mine. Sometimes people find that off-putting, and so I try to let them know ahead of time, I'm not being rude or anything, I just don't want to break your confidentiality. And I leave it up to them if they want to introduce themselves or however they want the conversation to go. Usually when I'm with my friends or family, they just kind of walk away. I've worked with so many people in so many different places, I don't remember everybody's names, and I'm horrible with names, so I think they don't even think anything of it anymore. like it's not like, oh, she's with a client, so don't be there. It's like, meh, she's talking to somebody, she probably doesn't remember, she's not going to introduce me, so they just walk away, which is a lot better for me. But again, it's always the patient's choice on how they want to divulge that information, or if they want to. You can stay anonymous. You don't ever have to say hi or acknowledge your therapist in public, and that's okay. We're not offended. Totally okay. We understand that. Difficult learning how to separate those boundaries sometimes, because when we live in the same community as people, we run into each other. So trying to navigate that can be tricky, but you know, again, that's where that supervision comes into play. So I hope that answers some of your questions about therapy and what it's like. Oh, I should probably talk about what happens when you come to therapy. I'm sorry. So first you would contact a therapist, right? Whether you find them through a friend or through your doctor, referral. Maybe you saw their sign on a building, or you found them online. So you contact them, and you need to know if they're accepting patients, kind of like any other professional. And then you probably want to talk a little bit about why you're seeking therapy. Like maybe it's about depression, maybe you're not having a good relationship, something like that. And to make sure that that's something that they work on. And then you guys will schedule an appointment, like an agreed upon time, and probably talk about payment, like an insurance or cash or however they want to do that. Some therapists will send paperwork out. I don't, because I never got it back. Some people are better at that. You have to fill out some paperwork when you come in. You have to sign some papers about confidentiality, consent to treatment, any releases of information, payment agreements, things like that. And then we also usually have like an intake to fill out or to talk about. And that's just gathering information about your past and present, about the problem going on, maybe some family history. And that helps us give a good idea for a diagnostic impression. And I know a lot of people get hung up on diagnoses. And diagnoses, I hate to say it, are based on what the insurance companies are telling us we can bill for. Truth. I talk to this a lot about people when they go to see their psychiatrist, because you cannot prescribe medicine for certain diagnoses because they're contraindicated to work. So if we feel like a medicine would, if the psychiatrist feels like a medicine should work, they may give you a diagnosis that helps them to get this medicine approved. And I've seen that in medical practices too. Sometimes they do things like that to be able to get the treatment that you need. And it's in goodwill. We're helping people. We're not doing something that's wrong or hurtful. We're just trying to get them the help they need. So diagnoses sometimes don't always mean what you think they mean. If you have questions about your diagnosis, I really feel you should always talk about that with your therapist or your psychiatrist. Sometimes that can be really helpful. I know some people have said, wow, that makes so much sense, and I'm so glad to like have a name for it. Now, the reason why we have diagnoses is so that we have a language, a common language that we can understand when we're talking to people back and forth. And that's through doctors, through insurance companies, and things like that. And so don't get too caught up in that. And ask if you have questions, right? So after you go through your intake stuff, you usually work on some goals, get an idea or like a roadmap of where you're gonna go in treatment, and then you set up your following appointments. Pretty easy, right? Therapy can be a really great experience. So I'm hoping that that brings down some anxiety about what it looks like when you go, and that you feel more comfortable in seeking it. So have a good day and look out for another video. Thanks. Bye-bye.